Good morning, everybody. I'm Dr.Trupti Kharosekar, fertility consultant from Cure Hospital, Thane. We meet here today to discuss about the various causes and aspects of infertility. Causes of infertility can be divided broadly into the male factor infertility, which accounts for nearly 40% of cases, the female factor infertility, which again accounts for nearly 40% of cases. There's a group where there's a combined factor related to the male and female infertility accounting for nearly 10%, and another 10% where the cause is not really known. To understand the causes of infertility, we first need to understand the physiology. This is a model of the female reproductive system, which consists of a uterus or the womb, two fallopian tubes or the transport tubes, and two ovaries, which are the two egg banks. Similarly, the male reproductive system consists of testes, where the sperms are formed, and transport tubules, which transport the formed sperms outside into the semen. So normally, in every menstrual period, one good egg forms in the ovary. It enlarges per day. When it is ready, it is ruptured from the ovary, which is called ovulation, and released and captured within the tubes. Around that time, if there is intercourse, the sperms, which are deposited in the vagina, travel up into the uterine cavity. The egg and the sperm meet in the fallopian tube. Pregnancy or embryo is formed in the fallopian tube and then transported back into the uterus, where it implants on the lining of the uterus and pregnancy starts growing here. So what could be the causes related to female infertility? There could be problems related to the ovaries, where one good egg is not formed in the ovaries. These could be problems like polycystic ovarian disease, where ovulation is deranged. Causes like endometriosis, where there is blood collection in the ovaries. Causes where there's premature ovarian failure, that is, the oocytes are depleted at a faster rate in younger patients, or patients who are ovarian reserve, which could be related to the age. Or chronic endometritis, or when the endometrium is damaged related to certain surgeries in the past. There could also be a subset of patients where the mouth of the uterus is abnormal, the mouth of the uterus, where the mouth of the uterus is lost, not allowing the sperms to travel out, or the cervical secretions, which could damage and kill all the sperms before they are available for fertilization and enter into the uterine cavity. Similarly, there could be problems with male factors, where the testes are not forming sperms adequately, where the testes are damaged, secondary to trauma, certain infections like mumps, or when the testes do not descend as they should normally, or when the blood vessels around the testes are dilated, not allowing them to function properly. All this can cause a reduced count, motility, and morphology of the sperms, causing male factor infertility. From the testes outside could be damaged secondary to infection or certain surgeries, which can again contribute to these causes. There could be a subgroup of patients where there could be erectile dysfunction related to chronic illnesses like diabetes or previous surgeries which damage the nerve supply to the penis and causes erectile dysfunction. It is important to understand the causes of infertility so as to segregate, divide the patients as in who needs ovulation induction with a self-tricycle, who needs ovulation induction with tablets or injections and intrauterine insemination or IUI, and a small subgroup of patients who might need advanced treatment in the form of assisted reproductive technology. On this note, I would like to end this session here. Please feel free to contact us